Thank you very much for being here. I'm Mike Thompson. I represent California's 4th Congressional District. I appreciate all the interest that is seen here today and across our country. People are coming out, speaking out about these horrendous cuts to Medicaid that we are dealing with right now. I've met with all of the healthcare providers in all 5 of my counties that I represent. And in every instance, it is very clear that this is going to have a devastating effect on the delivery of health care in our area. And the same is true in regard to delivering health care across the country. The Republicans passed legislation that teed up $880 billion in cuts for Medicaid. In California, 1 in every 3 patients is a Medicaid patient. In California, it's referred to as Medi-Cal, but the federal funding is Medicaid. So, and in one of my counties, 54% of the patients are Medicaid patients. So if you take that kind of money out of any healthcare system in any county in the United States of America, one of 2 things is going to happen. Either the healthcare providers are going to fold, or the cuts are going to be so severe that healthcare will be drastically limited. And I want to point out that if you get your healthcare through Medicaid, through your employer, through a private policy, or if you have a pocket full of gold and you pay for cash for all of your healthcare, you are going to be harmed by this Republican proposal. Because best case scenario, the healthcare providers are going to have to slash their services so much that individuals who come in, wealthy individuals who have the money, if they show up and for service and those services have been cut, they're going to suffer. This is a tragic situation. It needs to be stopped. And it goes beyond the immediate health care that we think about, clinics and hospitals and the doctor. There are also ancillary services that are paid for with Medicare. I have a constituent in my district who is employed. She's active in her community. She lives in her own house, and that all is made possible because Medicaid provides her a wheelchair, an electric wheelchair that lets her get out. If that funding goes away, she can no longer work, she can no longer stay in her house, and it's going to be more costly to taxpayers than the expensive nonsense that they're doing now. So thank you for your interest. I want to thank everyone from the healthcare space who's come out today to sound the alarm. It's important that everybody knows how dangerous this is and finds their voice to ensure that we can provide the pressure to stop this from happening. Now it's my pleasure to welcome to the microphone and the podium my colleague and my friend, Congressman Jared Huffman.
Thank you, Mike. All right, folks, I'm the other half of this Sonoma County congressional duo, Jared Huffman, and I want to thank Congressman Thompson for organizing this event today. Look, something very terrible is coming our way in the days and weeks to come, and it's so important that we see it coming, that we have an understanding of it, that there be political accountability for it, because this is not just going to hit the people on the front lines who depend on Medicaid for their health insurance, even though that's a big number. That's a third of the folks in my district and throughout the state of California. It's going to have spillover effects that impact everyone. So the 1/3, that's a big number. Beyond that, our nursing care for seniors is a huge impact. Medi-Cal is absolutely the lifeline of nursing care in this state and in this country. Disabilities, 100% of the people with disabilities depend on Medi-Cal. So the impacts go further, and the Medicaid expansion that happened in so many states, including California, has brought many people into coverage under the Affordable Care Act. So that is when you start pulling the rug out from under Medi-Cal, you have impacts across the entire healthcare ecosystem. And some of the families that I represent are going to see their premiums in the ACA marketplace go up 300% if these cuts go into effect. So no one should think that this is just the very vulnerable people who will feel the Medi-Cal cuts immediately and directly. It's going to spill out to everyone. When the VA starts laying off probationary employees and folks beyond just doctors and nurses, the system will begin to crash, and those veterans will need their care, and they will go somewhere. All right, and that means first responders will pick up the slack. The Jewish Free Clinic, who's here, they don't bill, but they also they can absorb thousands and thousands of people who will be pushed out of coverage. So all of us have a tremendous stake in this. All of us need to see it coming, and all of us need to hold Republicans in Congress and this administration accountable for this terrible idea to finance tax cuts for billionaires. With that, I'm going to hand off to Supervisor Linda Hopkins, who's very much on the front line of service delivery and community health here in Sonoma County, and I hope that this spotty microphone will hold up for her.
Thank you so much. I'm someone who believes deeply in a woman's right to choose. And